Lexington's needle exchange program entered its third week last Friday. So far, the Lexington and Fayette County Health Department collected 915 used needles and has given out 386 clean ones. State lawmakers passed legislation allowing the exchanges earlier this year, but one senator is already questioning whether the law needs to be changed. WKYT investigative reporter Miranda Combs looks into the concerns.
We've heard horror stories of people using needles, sharing them, passing around the rooms. I mean, they don't care.
Kevin Blankenship knows the world of addiction. He lived in it for years.
An addict is going to use regardless.
I don't know. I don't care. They're bringing the needles in. It's like taking the unexploded munitions out of a minefield and getting rid of them.
Dr. Rice Leach's only concern is public health, saying Kentucky has the most cases of hepatitis C per capita in the country. Kentucky's needle exchange, he says, in time will bring that number down and control the threat of other bloodborne diseases.
We are statistically removing the risk of those diseases.
You really don't know what you're getting yourself into. You have no clue.
Blankenship's story follows what's becoming an all too common path.
And I found myself saying that I'll never do heroin. I just do the pills. It's safer.
Prescription pills to heroin to homelessness.
Soon after I started using needles was when I kind of had that realization where I lost everything.
I'm not pandering to anybody. I am taking risky material off the street to protect the people who live here.
The controversial program has been going on for 3 weeks now in Fayette County. A person brings in needles and can get up to 21 back at a time. The planning for this space has been going on since spring, just after legislation was passed allowing needle exchanges in Kentucky.
The idea of reach out, get them to come in, bring their dirty needles is working.
So far, the number of dirty needles coming into the health department has been much larger than the number of people. For instance, one person brought in more than 400.
One of the things the bill was intended to do is to cut down on needle sticks.
But State Senator Whitney Westerfield worries that's not happening in Louisville, where it's not required to bring in dirty needles to get clean ones.
So they're flooding the marketplace with these needles, and we're not getting all those back in.
Westerfield says the needle exchange legislation never laid out rules for how the program should run on purpose, but that may need to change.
I'll speak for myself. My intent was that there would be a one-for-one exchange at least, that there be some requirement that you bring a needle in order to walk back out the door with one.
A Louisville Health Department spokesperson says the gap of people getting and giving back needles is narrowing since their program started in June. They, like Fayette County, say their primary goal is to protect the public health, prevent needle sharing, and get addicts back in contact with the healthcare system. Possible start to recovery.
You're encouraging healthier use, and as those healthy habits begin to change, they move away from substance abuse into healthier living generally.
Even if they don't know it, it kind of gets them slowly, subliminally introduced. They have signs up saying, if you need help, call this number, or whatever it may be. They're made aware that they can ask for help at any time when they go there.
And Westerfield says when they designed the needle exchange, they didn't put restriction on it, figuring different areas of the state would want to handle it differently. However, he says some of his colleagues are now looking at adding more rules to the program.
It is very evident this entire topic of needle exchange is both tricky and very controversial.
Right. A lot of people feel like it's continuing to feed an addiction for these drug users. Even Westerfield said he had a hard time wrapping his head around it, but statistics show that it does, in fact, work, he says.
Brave of that young man to be public in your story and talk. I mean, he brings it home when you hear him.
He really does.
Miranda, thank you.